Hello, this is Dr. Ding. So you need an eye exam. How do you choose the right eye doctor? Though the eye seems such a small part of the body, sometimes there can be different doctors specializing in different parts of the eye. So choosing the right one will save you time. Let me show you some common scenarios. If you just need to update your glasses or contact lens prescription, optometrists are the right doctor for you. These are eye doctors whose focus is to get the best prescription, as well as checking your general eye health. Some ophthalmologists also fit contact lenses, but many of them don't. So what's the difference between the two types of eye doctors? ODs have 4 years of education and training specifically in the field of vision and eye diseases. They are the primary eye care doctors who diagnose and treat eye diseases. Most ODs don't do eye surgeries. OMDs are medical doctors that receive 3 years of training for eye diseases and some with additional years for specialty training, which I will mention later. OMDs diagnose and treat eye diseases, including doing surgeries. If you have diabetes, then you need an eye exam every year. This should be a dilated retinal exam or retinal imaging to screen for diabetic retinopathy, which is a common complication of diabetes that may lead to blindness. You can see an OD or an OMD for this, but if you develop diabetic retinopathy, depending on severity, you may need to see a retinal specialist for treatment. A retinal specialist is an OMD that receives additional training for treating retinal-related eye problems. If you suddenly see new floaters and flashes of light, you should see an eye doctor immediately. This is one of the few eye emergencies, as it may signify a process retinal break or detachment, which need to be treated urgently, usually by a retinal specialist. But if such a specialist is not available, you should still see any eye doctor for a thorough dilated retinal exam to rule out retinal break and detachment. If the unfortunate happens, these eye doctors will refer you to resources that can help you immediately. If you have red or painful eyes, you can see any eye doctor that is available. There can be so many causes, and an eye doctor will listen to your story, examine your eyes to find out the cause, and give you recommendations. If you have a bump growing on your eyelid, you may also see any eye doctor. If it persists for months, you may need to have a procedure to resolve this, performed by oculoplastic surgeons or general ophthalmologists. If you have blurry vision, you can really see any eye doctor, because again, there can be so many different causes, and any eye doctor can find out why and give you the treatment. If you have dry eye, most eye doctors will treat dry eyes. But you have tried conventional methods such as artificial tears and warm compresses and still have bothersome dry eye, you may want to see a dry eye specialist. As I mentioned in another video, both ODs and OMDs can be dry eye specialists. Try to find ones that offer more advanced options such as IPL, lipid flow, autologous serum tears, etc. If you have cataract, which is a cloudy lens inside the eye to make vision blurry and dimmer, you should see an ophthalmologist for surgery. While all ophthalmologists are trained to do cataract surgery, some with specialized training may no longer do this. So it's best to see someone who lists cataract as their specialty. If you have glaucoma, you can see any eye doctor. For glaucoma that is difficult to manage with eye drops and laser, a glaucoma specialist should be consulted. This is a specialist that does glaucoma surgeries to further lower eye pressure. If you have macular degeneration, you may see ODs or OMDs if no treatment is needed and you just need regular monitoring. If you need treatment, you will need to see a retinal specialist. If glasses and contact lenses cannot correct your vision to a satisfactory level because you suffer from an eye disease, for example macular degeneration, you can see a low vision specialist who can prescribe devices and technologies to maximize your existing vision. If you have a child, Whether your child appears to have normal eyes or not, they need to see an eye doctor in certain critical ages for eye screenings. A pediatric OMD or OD is specifically trained to examine children 0 to 17 years of age. Most general ODs and OMDs also see children of various ages. If you have a crossed or turned eye, you will need to see a pediatric OMD who can do surgeries to correct this. In certain situations, you need glasses to correct an eye turn. These specialists, as well as ODs, can prescribe such lenses. If you're nearsighted and your RX keeps growing, whether it's you or your child, your myopia prescription keeps getting stronger, you should see a myopia control specialist who is an OD or OMD that uses certain eye drops, contact lenses, or glasses to reduce the rate of myopia progression. You should also see my other video on secret to stopping myopia. If you suddenly see everything as double, close one at a time to see if double vision goes away. If it does, you need to see a neuro-ophthalmologist. However, they're difficult to come by, so go see any eye doctor who will refer you to one if necessary. In certain situations, double vision can be a sign of a stroke, and you may need to go to the emergency room right away. Sometimes people have a hard time seeing well even when they wear the right glasses. If you have eye strain, blurry vision, and headaches despite wearing glasses, you should see an eye doctor to see if you have a binocular vision disorder. If so, a vision therapy specialist can offer help. So it seems a lot and confusing, but the reality is that if you see an eye doctor that cannot address your eye problem, at least they can direct you to the right source. Still, it is helpful to always call your eye doctor's office and tell them your specific needs so that they can decide if you are the right patient for them. I hope you find the right doctor right away.